Multiple sclerosis is an autoimmune disorder of the central nervous system. In multiple sclerosis, the body's immune system destroys the myelin sheet, a fatty coating that insulate nerve signals and ensure they reach their destination. Immune cells, such as T cells, are typically not found in the brain because they're unable to cross the blood-brain barrier. However, in multiple sclerosis, they're able to do so. Due to this misplacement and change in environment, immune cells recognize the proteins on the exterior of the myelin sheet as exogenous objects and release cytokines. Cytokines promote the degradation of the blood-brain barrier by recruiting more B and T cells and macrophages to the site. B cells will then start forming antibodies for the myelin sheet, which further promotes myelin degradation, whereas macrophages directly degrade myelin. In the brain, myelin is degraded faster than it is replaced by oligodendrocytes, which produce myelin for the repair process. The signs and symptoms of multiple sclerosis are motor, sensory, and cerebellar. Most patients experience unusual sensations, such as pins and needle sensations and numbness. Muscle weakness, cramping, rigidity, paralysis of the limbs, the trunk and head, difficulty with balance and coordination, fatigue, involuntary movements are all common in individuals suffering from multiple sclerosis. The sensory symptoms of multiple sclerosis also include tingling, tinnitus, and impaired hearing. Cerebellar signs and symptoms include nystagmus, loss of control of body movements, dysphagia, and severe fatigue. Other signs include constipation, incontinence, sexual dysfunction, and decreased emotional stability such as depression, bouts of anger, and euphoria. Multiple sclerosis is a mysterious disorder because there is no clear cause for it. Diagnosis is based on patient's history, clinical manifestations, and presences of multiple lesions observed on MRI scans. MRI scans may show sclerotic plaque and white matter lesions. Cerebrospinal fluid analysis may also show increase in oligonucleotide immunoglobulin G. By the same token, there is no cure for multiple sclerosis. However, there are medications for the relapsing remitting type. Corticosteroids modulate immune responses and reduce inflammation by reducing B and T cells that trigger demyelination of the neurons. Immunosuppressants such as beta interferons decrease inflammatory cytokines in the brain and increase the function of T cells. Other immunosuppressants prevent T cells from getting into the brain by blocking the receptors on the surface of cells to which T cells bind to get through to the blood-brain barrier. Plasmapheresis, where the blood is filtered to remove disease-causing antibodies, is also another means to manage relapsing remitting multiple sclerosis. Unfortunately, there is no effective pharmacological treatment for progressive multiple sclerosis. Treatment is limited to the management of the different symptoms with physical and cognitive therapies. As with any disorder, early intervention is key to ease symptoms and slow the progression of the disease. Exercise can lift fatigue, increase and maintain strength, flexibility, balance, and endurance. A balanced and healthy diet that provides energy and decreases fatigue is also recommended. Whole grain carbohydrates for steady energy, fish and lean chicken for maintenance and repair of skin, bones, and teeth, and omega-3 fatty acids and vegetable oils to promote absorption of vitamins and minerals should be part of an MS diet. Last but not least, rest is important to prevent symptoms from getting aggravated.
Complications that result from having MS include sensory impairment, problems with bladder, bowel, and sexual functions, depression, venous thromboembolism, and corticosteroid-related complications. Something to look out for is the MS hug, which is a feeling where the chest is tight, making it difficult to breathe. Gabapentin is a medication that can help relax the muscles around the chest. The course of MS is variable and depends on the type and factors such as gender, age, and the degree of disability, as well as first presenting symptoms. Though some will not become severely disabled, many experience symptoms that cause pain, discomfort, and inconvenience. According to the National MS Society, 2/3 of people with MS are able to walk 20 years after being diagnosed. However, as years go by, symptoms worsen. eventually confining a person to bed rest. Research has shown that life expectancy is 5 to 10 years less compared to those who are unaffected. And with that, I hope you learned a thing or two about multiple sclerosis. Thanks for watching.